Good evening. This is John Warren, publisher of the San Diego Voice and Viewpoint newspaper, coming to you with our program from the desk of the editor. Each week, I like to remind you that the Voice and Viewpoint is San Diego's oldest and only African American publication. We cover within San Diego County 89 zip codes, 17 cities, unincorporated areas. Our paper is sold over the counter in retail outlets such as 7-Elevens and other stores, but we also have single copy newsstands. And in addition to that, the paper is online free every week. You can download our app in the Google or Apple store. We provide papers to our churches every Sunday. We provide papers to our seniors. We provide papers to our libraries. We provide papers to our schools in terms of some of our students. And so our goal is to live up to our motto, which says that a people without a voice cannot be heard. And since we are now online and we are digital, our reach far exceeds San Diego. Major cities are San Diego, LA, San Jose, East Coast, 184 countries where people looking at us. Our contacts now come from Canada, the United Kingdom, and the numbers just continue to explode in terms of people following both the paper and GOD radio. And so you are able to call us if you like, if you have a question or a comment at 858-251-6111, 858-251-6111, and we will have someone take your questions if we can, or your comment to carry forward with discussion. We will also be reached at godradio.one on the internet, and we are streaming on Facebook
and YouTube.
And if you should miss this program, or you know someone who missed it that wants to see it, then they are welcome to go to our archives at GOD Radio, and they can pull up past programs. So before we introduce our guests, I want to acknowledge Dr. Thompson, as we were in partnership with GOD Radio and the Voice and Viewpoint to do this each week.
Well, good evening, everyone. This is a very busy season. Want to encourage you all to definitely stay conscious, stay woke, and continue to read the Voice and Viewpoint and tap into GOD Radio 1. We are here to make sure that we are your trusted messengers in all that we do. So, Dr. Warren, it's really good to be here tonight. I'm very excited about our guests. San Ysidro Health has been doing some amazing things in our community. And I'm going to pitch it back over to you, Dr. Warren, for you to introduce our guests for this evening.
Okay, so we're very fortunate to have Miss Vernita Todd, who is an executive director with San Ysidro Health. And we wanted to do this because San Ysidro Health, I've followed it over the past 25 years and how the organization has grown from just being there to just spreading out in the county, serving over 160,000 people. And she comes with outstanding credentials. One of the key things, she's a fellow with the American College of Health Executives, which is no small scenario. She holds a couple of masters, and she's been strategically involved in healthcare. She sits on the board for the California Endowment, which one of the past presidents came from San Diego, Dr. Robert Ross, who came from here, and we worked very closely with him during the implementation of Cover California and getting it out into the community. So we're turning a page here, and San Ysidro Health recently purchased the Jacobs building, and they're going to put an urgent care facility there. But I wanted to have Ms. Todd on with us this afternoon, because I need her to help tell us some of the things about San Ysidro, because it might have started off just dealing with the Latino community, but it's so much more than that in terms of what it's become. So I want you to take a few minutes to do the intro like you were doing a sales pitch for San Ysidro. And yes, Dr.
One of the things you said, she came to San Diego. So, we're going to ask where you be, who your people are, and how did you get
And
here.
my
So
fa- yeah,
so
yeah.
that we know,
Okay.
and we know you're part of a very prestigious organization that we all love. So let's share
Yeah,
a little
yeah.
bit about
So,
yourself
yeah, by
personally.
all
Also,
means, before you
Okay.
even go into that, tell us about you, because there are people listening that want to know.
Oh, well, first of all, it is a pleasure to be here and to join you. Dr. Warren gave me a promotion in 5 minutes. I am an executive director,
Okay,
but not the executive director
okay.
for San Ysidro. But thank you for having me here, Vernita Todd. I am originally from Clarksville, Tennessee. I have been here in San Diego since 2016 after a long career in the Midwest in community health centers and serving underserved families. So I do have a lot of degrees. I tell people what you should hear is I also have a lot of student loans, but I believe in them. They have served me well and allowed me to enjoy life and enjoy a career that I have now. I am a Delta. I think that's
all
the
right,
organization you love.
Go and throw up the sign.
Okay. But I am a Delta since 1989, so I'm going to age myself there just a little bit. And I no children, but I am the last child of James and Sinclair Largent. Proud of that. My mom is still alive at 86 years old. And so it's a blessing for me to just say her name out loud, Sinclair
Okay.
Largent, because everybody's not fortunate and blessed like
That's
that,
true.
right? So I'm proud of the work that I've done that's brought me here as a community health center. The work, I actually didn't come here for San Ysidro. I ran a community health center for 11 years as a CEO in the Midwest. I was recruited to San Diego to serve in a government affairs capacity for Health Center Partners, a consortium of health centers.
Okay.
And so I came here in 2016 in February with a smile on my face, and everything was great. And then the election happened. And we know that was the first Trump administration. So I then spent every month in D.C. for a year trying to convince them not to kill Medicaid.
Gee.
And after 2 years of that being my life, I realized I prefer being with our patients and making sure they get what they need instead of trying to teach folks how to care about each other, something that's common decency. And so the CEO at the time, Kevin Mattson, said, "Hey, why don't you come work for me? I know this is what you love to do," and
Okay.
had this opportunity as the strategy officer. I've had a couple of roles, that one, but the current one I'm in is the executive director of San Diego PACE. And that is a program that I hope we can talk a lot about today because it serves seniors and it is a key component of our growth in Southeast San Diego.
We want to hear a lot about it. I see the trucks all over. I'm in a senior facility. I see them coming, picking up people every day. Some of the people painted on the vans look like me, but most of the people being picked up don't. And so we got some issues there, yeah.
Well, and what my mama say, tell the truth and shame the devil, right?
Yeah.
So one of the things that we always talked about with our leadership at San Ysidro is if you're going to go into a community, that community, your employees better reflect that community, your patients better reflect that community.
Right.
So what I think you'll find as we come into Jacobs, that the faces you see on those vans will start to be the faces reflected in those clinics.
Good.
One of the proudest moments I've had is even in talking to the people involved in Jacobs, because there's been some hesitancy, right? We came in, there was some kind of stuff in the game, right? And we came in after the fact.
Yep.
And so we're picking up a few of those pieces, but every time I say, well, send me in, boss, and let me tell them what we're going to bring. Because as a Black woman, I am proud of the services we're about to bring to Black people in Southeast
Yes.
San Diego. But beyond that, to English-speaking people in Southeast San Diego. And I say that because we are culturally competent and we're very diverse. And so many of our employees and our staff are all Latino or Spanish speaking. And there's a level of cultural competency that we ask people to accept as long as it's somebody else's language.
Yeah.
And so one of the things that we're identifying is cultural competency means I can sit somewhere and understand every word everybody is saying around me too. And that is the goal for Jacobs Center. And so while we will have Spanish-speaking staff, the goal will be that most and all business will be in English. So it'll be comfort and
So the
competence.
staff
with
will
folks.
be bilingual, probably.
Yes.
In what
Some-
you're doing.
some
Some
staff,
will be.
yeah.
One of the problems we often have, and I've tried for probably the past 20 years in San Diego, I did it in my church, starting basic Spanish conversation classes, trying to get people to understand that it no longer will discrimination be based on race, but it's a question of whether or not you're bilingual. And most people in San Diego are, whether they speak Tagalog or Arabic or Swahili or French, and we have many French speaking people here, or Spanish, but most African Americans, most black people only speak English. And I know my grandkids, they started out in Spanish immersion from kindergarten in Eastlake. And today they're like 17, 18 years old. They are so fluent in Spanish that you would think they were, from south of the border, because they're bilingual in terms of what they're able to do.
One of,
And yeah,
one of the things that would love for you to dispel and take away the mystery of what this new facility will look like. Is it going to be all 3 floors that are going to be with San Ysidro Health? There's going to be a mixed-use facility. And, like anybody who lives in the community, this is the community that I actually live in. How will traffic and the flow, you have the school there, you have all these different things, you have the shopping center. How is that going to work, and how are you rebranding the building? Is it still going to be Jacobs, or are you going to rebrand it totally? Because sometimes rebranding takes away the stigma of what might have been there in the past.
Well, I think part of the commitment that the leadership made to the Jacobs family is to honor that their commitment. And so their name will remain on the building. Okay. You will see a big fat San Ysidro Health and San Diego PACE logo there, but the aesthetic of the building and the community will remain the same. We actually really like it, right? Mm-hmm. And so we thought, why would you come in and change it? We have had to do considerable work on the inside because of what will happen.
Flood,
and the type of business that will be there versus what was there. We're pleased to say on the top floors there are nonprofits and organizations that are functioning there that we want to stay there as a part of the process. On the first floor we will have an urgent care and the San Diego PACE program, which is what I was talking to you earlier. So that program for seniors can hold up to about 500 folks, but includes an adult day health center, a primary care clinic, and a kind of community-based clinic for our seniors in that area. So half of it will be that. And then a portion of the first floor will be in urgent care. Okay. And it's important. Let me bring this to you though. Several years ago, we had folks come to us from the community that said, "We need services. We need urgent care. We need services." And so there were a lot of partners that came around the table that started talking about it. And before I get too deep on it, it just became possible or clear that what they were thinking wasn't possible because of licensure, because of liability, because it's medicine, right? Mm-hmm. So there are a lot of things you can do with volunteers. Mm-hmm. But you can't coordinate medical health care and responsibility and liability solely as volunteers. Right. So who's going to hold the license? Who has the liability? Mm-hmm. Who has this, that, and the other? So that thought that everybody could pinch in a little was just not realistic. Mm-hmm. And so I think there were several folks that were looking at, well, what can we do? And it just didn't resonate. And then we were approached. Mm-hmm. San Ysidro Health was approached by the family about potentially purchasing that building. Mm-hmm. And my CEO called me and said, "Here's your urgent care." Mm-hmm. And he'll tell you, the tall white boy from Nebraska, that was the first thing that came through his mind. And it's important that I share that with you because urgent care is not our business. Primary care is our real business.
Right. That's why I was going to ask you, when we say urgent care, does that mean if I get an axe to my forehead, I come?
No, it ain't an emergency room.
So that's what I want to make sure that we very clearly define what urgent care services look like in a community and also the other services.
And I would have to get with all of my colleagues because I'm on the other side of that house. But what I can tell you is if it requires an ambulance and surgery, don't come to the urgent care, right? It is not that. It is my kid fell and is his arm broken. Okay. That type of thing. Or same day access to care. My kid is sick. I need to get in. I don't need to go to the emergency room. I can't get into my doctor, but I can go walk into this is urgent care. And there's a reason that we set it up as the hours from 12 to 8. There was no need to replicate the hours that our Careview site is open, our King Chavez site is
Right,
open, and
right,
so we
right.
have those things that are open in the morning. But 12 o'clock is kids start hitting lunchtime, and that 3 o'clock hour is where we find 3 to 5 o'clock is where people were having trouble getting access to care.
Right.
And so, what do you do if your kid is sick and you don't want to take them to the emergency room? So, that sweet spot of 12 p.m. to 8 p.m. covers most of those things that would be required in an urgent care. And we like to share with folks that we've rolled out 3 urgent care. This will be our 3rd urgent care that we've rolled out. And we've looked at it in those hours, what makes the most sense. Because as a business, too, if you open and ain't nobody coming in, right? I just want to be
Something
realistic,
wrong,
right? You
right.
still got to pay folks.
Yeah.
And so what is the model that makes sense? And then over time and as utilization shows itself, then you pivot and you respond to what folks need. But you don't go in and say, hey, we're going to be open from 8 a.m., 24 hours a day. Because my commitment and what I've shared with my leadership is we can't go in and leave in 3 years. So there's nothing we can, if we're going to go in, we're going in. And if we're going to go in, we're not going to try to be who we are in San Ysidro because this is Southeast San Diego, right? And so that requires a level of humility to say, we don't know the community like you do, help us learn. We don't know the residents like you do, help us learn. As well as the fact that you don't know us like we know, or you don't know us like that. So you're going to have to learn us and learn if you can trust us.
Yeah.
When
You
do
hear what I
plan
said?
to-
If you can trust us.
When will you open? When do they plan to
It's gonna be a
open?
while. It's gonna be a while. It'll be a while. So they're working on working the stuff now. It was probably April or May of 26.
Okay.
Probably
Wow,
another,
it'd be at least another year.
at least
huh?
another year.
Okay.
Well, one of the things that I want to applaud you on it is that you guys have bought the building, and you bought the building, and it wasn't in the best shape
No.
when you got it because of the flood and the things of that nature. But I'm loving the fact that you're not rushing to throw something together and then have the community be in a complaint status because they don't feel like it's given the quality. What I'm hearing that you're saying is we're taking the time to understand our community, learn our community, and also provide a quality healthcare service in the community that not only will they be proud of, but that it will be utilized to its fullest. And that is a great start and a great message to come into with the community. And I think that in everything that you're doing, you're saying that we're going to honor all stakeholders that are involved. But we're also going to make sure that we don't lose people because we're using an old model, but we're going to design a model specifically for the community that we're getting ready to serve.
Absolutely. And I'd like the point that you say, we have got to come along with the community, not in front of. Now, there are things that we know that are required in that clinic. It's a state-of-the-art clinic. I don't need to have stakeholders come tell us how to build a state-of-the-art clinic, right? There are things that we bring to bear that we know. But in preference for how it's best brought to the community, how we introduce it, how we engage folks, how we employ folks, how we brand it and engage the community is going to be critical. Now, so we'll spend the next year probably starting to have focus groups and talk. And I fully imagine that there will be several of those meetings where people are just mad, right? And I have a feeling, well, I can tell you for sure their concern is not with San Ysidro. We came in after the fact. We're proud of what we're bringing to the table on our dime.
Well, those are the places,
Right.
that's where people like us come in, because when we talk about focus groups and community input, we were, at Voice and Viewpoint, was very much involved when the Live Well Center went from design to building to operation. And we had a lot of real concerns about that. One of the things, for instance, was they wanted to put the probation department in there, but we didn't want people walking around in Gestapo uniforms intimidating folks. And so where you're located, down the street from you have the community San Diego Family Health Center. At one point, you got Live Well near you. You got Tubman Chavez further back down the street. You got Paradise Valley, and so you've got, and then you have the medical complex right up the street there. So you got a lot of people providing a variety of different services. Okay, and so I think it's important that you're taking your time. For instance, when the Tubman Chavez Center opened down near on Euclid, I remember there were some people from the community that were concerned because uh, a family had dental offices across the street. The Crawford brothers, remember Brother Thompson? And when they opened that center, they had dental services in there that were so far beyond what the family was able to offer that it really almost drove them out of business. But then when some people from the community tried to go there, there were issues. Because I remember a particular person who's deceased now that went there. They didn't die from going there, but they had a dental problem and they had all kinds of dental chairs and services. But this person didn't have a bill that had their home address on it. And so they wouldn't treat him. And he had like an abscess and he was in an emergency situation, okay? And he was not Latino either in terms of going there. And so the focus groups you're talking about are going to be crucial. For the record, the San Diego is referred to as southeastern San Diego,
Oh.
as opposed to southeast.
Thank you. Right?
Yeah.
Don't let me walk in a room have people wanting to
Yeah,
throw
you know
stuff
what
at
I'm saying?
me.
Yeah, the late Councilman Stevens went through a great deal to make sure that it was referred to as southeastern San Diego.
And so many people, you'll hear different people say southeast and then southeastern, but it is southeastern. But it is us working together. I believe that many times people, if they don't know and you don't have enough kindness to share with them, I believe when you do things in love, and I think that the approach that I hear you're coming in is from a very community approach, and I think that's what's going to make this a different venture. And honestly, having a person of your stature coming in and leading a portion of the charge is going to also make people feel like their voices will be heard. We've worked with San Ysidro Health for quite some time, and you're literally the very first person that is in the family of us that we've seen. So it's exciting to know that from the tall Caucasian brother to you, diversification is taking place to make sure that they're serving the community that they're in. Can you tell us more about the PACE program?
Sure.
Well, before you get to PACE, I need you to go back and say a little bit about the historical aspect of San Ysidro.
Oh, okay.
Because it's such a profound story in terms of how the few people came together to start what's grown to be so big. And I think that is phenomenal. So maybe you can just say a word, because our community is not aware of some of that history.
Well, this is one of my favorite stories, and actually it's timely because just about 6 weeks ago, our last founding mother passed away. And so San Ysidro Health was developed in 1969. There were 7 women who, once the only doctor in Chula Vista or in San Ysidro left and moved to Chula Vista, they didn't have anybody to see their kids. And so these women who weren't connected to anybody, they didn't have any power, they didn't have any influence, banded together and said, what could we do? And found some professors at the university who wrote some grants for them to start this one-room clinic in a trailer in San Ysidro. And that was in 1969 with volunteers, just really seeing kids, moms, and babies as we went through. If you fast forward from 1969 to today, 160,000 people in our care, 50 clinic sites and programs, 4 PACE programs, with a mission to improve the health and well-being of the communities we serve with access for all. And I think it's important that we say that. They didn't say with access for Latinos. They didn't say with access at the border. They said with access for all.
Right.
And what everyone here needs to understand is for us to come into southeastern San Diego, the board had to approve that.
Right.
And what did they say to us? Do they need care? That was the only question they had. Not who's being served, none of that. Do they need care? And if we were able to identify they needed care and were wanting us to provide it, that was all they needed for that investment.
Pause for a moment.
Sure.
And something just occurred to me. Remember the Ocean View Health Center?
Yes.
It was named after Dr. Warren Cherry, who was a black physician in the community who died of prostate cancer, unfortunately. And there was a period of a lot of conflict over how it was operating. And I believe at some point San Ysidro got involved with that.
Yes.
And that kind of rescued that facility. And maybe it is one of the 50 sites you're talking about today.
Absolutely.
And most people don't know the history of that, but that was a very, very strategic move there because it was a very sensitive matter in the community in terms of people. People like the late Reverend George Walker Smith was on the board, and
Comprehensive health.
yeah, and folks, comprehensive health was the key, and Paul Sims was involved in it, and all of these people who are gone now. But yet you have preserved something that was very crucial all through the COVID pandemic in terms of treatment and vaccines and serving people. So I kept up with you.
I know, I like it. You know your business. But Ocean View is a great example. All
Yes.
of the growth that we have had over the last probably 30 years at least has really been people coming to San Ysidro and saying, hey, we like what you're doing. We're struggling, or could you help us, or could you
Right.
join with us? And
Right.
so that happened at Ocean View. It happened at El Cajon with
Yep.
the Chaldean population. It happened in Alpine with the rural white population
Yes.
that sees us very differently there, let me say.
Right.
And a lot of those things are folks that do come to us and say, what can you do? And I think they do it because of the earned reputation we have for care.
Well, see, what you said about Alpine is so important because back during that time, I guess we're talking maybe 25 years ago, we lost, what was it, Edgewood? We lost facilities, we lost hospitals that we had in East County. We ended up with just Grossmont as a major facility there. And I know from living in Hamul that many times from a rural standpoint, when people were ill or emergency, the 911 could come, but they would have to take them to the elementary school to wait for a helicopter to airlift them
In
because
some-
they weren't going to survive.
Yeah.
Yeah.
Even in actually at our center in Campo, we have a community center near our center in Campo, which has the only green space at the baseball field where helicopters can
See,
land and pick
yeah,
up
and they
folks.
kept it. And at one point, they were taking people not only to Grossmont, but where the garage sits now at Sharp Memorial. That big garage where you come in for the emergency and come in the
Okay.
side entrance. That used to be just a helicopter landing pad there because they had so much business that was coming from the east. And so that's why Grossmont is so crowded. And it's good to know that you are in places like Alpine and Campo, that you have really expanded and brought the diversity that we're talking about. Because I've lived rural for a long time. I was a horse person for 20 years, so I'm East County cowboy. So I know all about from the fires to everything that we've gone through out there. And I think it's very significant that you all were there. And I think it's important that our community know the things that we're talking about, because that's why we wanted you to be here.
Thank you. I would add that the same level of get to know your community was required out there. But we did the acquisition of them during COVID.
Right.
So we really weren't able to be intentional about this is who we are and this is what we're doing and blah, 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 because folks kept saying, well, this is East County. What is San Ysidro? What does San Ysidro have to do out here? And I just, let me give you this one last story as a part of the San Ysidro history. You know, San Ysidro is named after Saint Isidore, right? Who is the patron saint of farmers, right? But part of his claim to fame or why people hold him so dear is that he would give everything he had to others before he gave to himself. And so as we looked at the name and people said, oh, well, you need to fit in San Ysidro or your name's San Ysidro. And I said, no, I am San Ysidro. You're San Ysidro. I can tell by your
Right.
spirit. And so I'm proud of that name. Now, I'm not Latino. I don't speak Spanish. That has nothing to do with me. But the foundation and the spirit of where it comes from, I'm willing to explain that to people. And
That's
I
like-
think when you do, they get past the name.
Yeah, because that's like trying to change the name of San Diego because it's St. James in Spanish, right?
Yeah, it's like,
Or even in the sense of changing St. Vincent de Paul or,
Yeah, yeah.
other hospitals that are
Right.
named
Yeah.
after very important people in the community. Again, what you're doing now is you're really giving people a new vision and a new focus of even San Ysidro Health. Many people have associated San Ysidro Health as location
yes.
versus
Right.
the
Yes.
name and the saint. and a very powerful move. And I was guilty. I associated with the place,
Yeah.
and not with the name of the person, and that also opens people's mindset to why the name, and it's not family this or this. It's San Ysidro because of the spirit of it, and that's goes forth with the spirit of the organization.
That's right.
And Daniel, Daniel helped me
Hernandez.
understand.
Daniel Hernandez.
Yeah,
That's who you're
Daniel
looking for.
Hernandez. Daniel Hernandez helped me understand because I remember when he first started doing things with San Ysidro, and 25 years ago, I had newsstands all through the South Bay community, right down there where there used to be a Rite Aid and stores and 7-Elevens. We were in all those places with physical copies every week of the paper. And there's the community right down to the trolley line at the border. We were right there all the way up the trolley line. But as things changed and evolved and demographics shifted, all of those changes occurred. But Daniel helped me keep in touch with San Ysidro. Even when Paradise Valley was trying to go in a different direction, San Ysidro was still reaching out. When, what's his name at Paradise Valley, because he sold Alvarado, when he wasn't reaching out. So that's why I wanted this history in this period, because people need to understand, and your being there is as significant as what San Ysidro has done, based on who you are and what you bring to this picture when we don't have a whole lot of folks that look like you doing stuff. And we have some people in other agencies like UC San Diego Health that they look like us, but people are nervous because of DEI, and everybody black is not DEI. It's significant. I don't think people understand that it's more than the masters. When you say you are a fellow of the American College of Health Executives, that's important. All the people who are fellows of the colleges, you work to get that. That's just as important as being MD. All right, to me it is, because I have a lot of friends who are fellows in various of the colleges. Okay, and Nick Macion was one of those fellows in terms of colleges. So we have to educate people as to who you are, what you're doing, and that's also why we did our annual health piece, which we have shared with you, and we're sharing throughout the city, Minority Health Report. And all of the ethnic groups that are in our community are in that book. The diseases, the illnesses, mental health, child care, whatever it is, we've covered those things. And you're covering those things. And so we want to expand this so that we can work closer. And without someone like you, PACE San Diego would never reach out to understand us. It just wouldn't happen. The endowment. Most people here have no idea about the endowment. And you're important because the endowment has new leadership now, but that leadership does not have the benefit of the history
Right.
that Bob Ross brought, not only from San Diego, but that he carried to the state, because he was very instrumental. Endowment was very instrumental when we were getting Cover California so that we could do the Affordable Care Act.
A $350 million social bond
Right, and we were
that we still got to pay back.
And we were being left out initially. Before we went to meet there and he got involved, they were planning to just give money to a couple of white .coms and to Berkeley, like the rest of us didn't count, and so we jammed that and turned it around. So I'm excited. I want people to know who you are. I had to go a while, Dr. Thompson. It's so important for her to have said so. Whatever I interrupted that you were about to answer for him, by all means, go ahead.
Being in the older generation now, I can say that I have crossed over into the 60s.
You wear it well.
Yeah, thank you. The need for elderly health and things of that nature have become more and more relevant, especially to colleagues that are now taking care of parents and grandparents. Can you tell us about the PACE program? Because it's going to be a very welcome addition to the community that we're in.
Yeah, I'm actually very pleased to talk to you about San Diego PACE. First, I'll say PACE stands for Program of All-Inclusive Care for the Elderly. Across the country, there are 185 PACE organizations serving about 85,000 seniors. So it's a relatively small program. in comparison to, say, like the community health center world that
Right.
sees over 30 million folks nationwide. But PACE is special for a couple of reasons in that it is both a provider and a health plan. And I bring that to your attention because as a community clinic, we are your doctor, right? You go to see your doctor, but anytime they want something, who do they have to call? Your health plan
Yeah.
to see if you can get it. And so all PACE programs serve both the left side and the right side of that equation, removing the middleman, removing the bureaucracy, and removing the excuses for intervention that's necessary. So if our patients need something and our providers say they do, we as a health plan can do it. For example, we deal with frail elderly. Part of the issue and the most concern is about falls. We do home assessments. You go into their homes and you see, wow, they've got carpet and it's snagging the walker, or they really need grab bars so they can get out of the tub. Well, we as a health plan can pay to rip up the carpet. We can pay to put the grab bars in, and we do, because it's much cheaper for me to install grab bars than me to fix a hip of a 90-year-old, right? And there's all of those things. And so I don't say it just because it's money, but most health plans could intervene like that. They don't. But we at the PACE program and PACE nationally acts like that. So think about it, doctor and a health plan. So you need it, we can provide it. It is also full, comprehensive, coordinated, capitated care, all the C's. And the reason why that's important is coordinated in that we have 11 disciplines that meet around care about our participants.
Okay.
So you go to a doctor and you see your MD, and he might say something to his RN or MA, all the letters, and they do their things. And if you need anything, they'll send you here and send you there and send you here. But we have a nurse, a social worker, a dietitian, your transportation, the activity coordinator, your personal care, your home health nurse, everybody who talks about what care does Leonard need.
Well, praise the Lord. In that mindset, what about the mental health of our seniors? Is that also included? Because we're dealing with a lot of seniors that are losing their mental health capacity, and many times when they go to the doctors or they're being evaluated, they have the point of, and I'm going to say this from an African American perspective, or anybody who has that get up and go. If they get to be evaluated and you're going to try to see if they need additional this, they all of a sudden become very lucid.
Yeah.
They come and they put their best foot forward, and then they say they don't qualify. But then the next 5 days, they're back into that state where they're not lucid. How do we serve that population because, if you're going to tell me you're going to take me from my home, or are you going to do this for me, and I've been doing this all by myself, and so they put that best foot forward, but it's not the true foot.
Yes. So let me step back for a couple of reasons. One, the population for PACE is specific, right?
Okay.
So I would imagine, healthy young man, you're not qualified for PACE, right? It's a
Lord.
frail,
Praise the Lord.
elderly population. So you think of our aging folks, not even you with that cane, right? So we think of our aging folks who might be put in a nursing home.
You mean 80-year-olds don't qualify?
Not if they're healthy and can get by on their own, no sir, because the state has to determine it, right?
Right.
And so let me give you the qualifications. You have to be over 55. You have to be deemed nursing home eligible, right? And that can be medical or behavioral or mental health. It can be either one of those. You have to live within the zip codes that we serve, and we serve 114 zip codes of San Diego County. And then you have to be able to live independently in the community, which means if you can't stay at home by yourself, you're not eligible for PACE.
Right.
Right? So that is how it goes.
That's why they keep
not,
you up, yeah.
You might not need some help. Somebody needs to watch you, or you need it, can't get to the bathroom or the shower. That's the kind of thing that we stand for. So 55, live in the community, nursing home eligible, able to live safely. Once we get the assessment of that, the state determines their eligibility for PACE. But regarding your question about behavioral health, our assessments aren't one and done, right? So you talk to a doctor, and you talk to a social worker, and you talk to a case manager. You can't be on best behavior all those times, right? And so because there are a lot of folks involved in your care, we're trying to figure out what is your goal. And if your goal is to remain at home, that's our goal too.
Now,
Right?
let me ask you a question. To receive PACE benefits, do you have to not own a home? Are there certain you can't have a bank account? 'Cause this is a question that came up. It says you got to be dying and have no money or assets.
And I'll be honest, I think that's Ms. Hicks. It is a Medicaid program. It is for low income folks.
Okay.
Who, like, if you have my mother, who's an 86-year-old retired nurse and could use PACE, won't qualify because she makes about $400 a month too much.
Okay.
Right? So it is a poverty-based program. So what we often find, though, is for our elderly people who have transitioned either their assets or who are now on Medicaid because they need the IHSS or the other services, will qualify in that way. But responsible people who are just getting by and they have enough, just enough to not be poor, unfortunately, this program is not designed for them, and that's unfortunate.
Well, there
So,
was
so you're right, Ms. Hicks.
there were some changes made recently because this issue kept coming. It came up with Section 8 and a whole bunch of things as to whether or not people could still own property and have services as opposed to being forced to put their property in a trust so that they qualify for services, number one. The other thing is we have all these various HMO health plans out there. Okay, so a person who is fortunate enough to have like Medicare and a supplemental, which is a PPO program, then they might need the services, but they can't qualify. But if they're in one of the other groups, HealthNet or some of those other things, then PACE will work with those I guess I will call them HMO groups, to still provide the service for people.
Well, no, what happens is PACE is a CHG. We're a health plan just like they are.
Okay.
So as the population that's eligible for us, the difference with CHG is anybody who can get Medicaid can be a CHG patient.
Okay.
But us, remember, 55, live in a
Right.
community, nursing home eligible, which means nurses at the state level have to review the assessment.
Right,
And say,
okay.
do they go in PACE? And the reason that occurs is because, remember, all those C's, coordinated, capitated care, it is the fact that we at PACE are responsible for all levels of care. If you go to the hospital, that's us. We follow you. We're your doctor in the hospital. You need to go to SNF, that's us. We follow
Okay.
you there. You're in
Okay.
rehab, that's
Okay.
us. You need
Hold on.
kidney replacement, that's us.
Hold on. You said SNF. What's a SNF?
I'm sorry, a skilled nursing facility.
Okay, because everybody, our
sorry.
people gonna ask us, "Oh, what's a SNF?"
My bad. But skilled nursing or rehab programs, or when you have to go to the hospital. So we are responsible for all of that care. We
Okay.
pay the hospital bill when you're in the
Okay.
hospital.
Well, let me just say this, because we're going to have to stop because of these last few minutes. We got so much to talk about in terms of Juneteenth and the activities.
Sure.
You are welcome to just continue to sit here, be here for this part of our discussion. We're going to have you back at another time because we can't cover all the stuff you do in one event. I hope that this minority health piece will be helpful. And if you need more in terms of some facilities, you'll let us know. And the paper that I gave you, which you put in the car, was the issue that was included in. And separate from it being included, we still have copies to be made available for the rest of the year. And so between those things, it should help you. The paper will help people get familiar with who we are and what we do and how we do it. And at the same time, we're online. And the people that you serve are the kind of people who are still reading.
Yes.
Because all of our folks are not on social media. So we cover all spectrums. Okay. Matter of fact, my car is older than my staff, but we're getting stuff done. So if you can just sit, if you like to stay with us for a moment, we got a few more minutes left. And Dr. Thompson, we need to say a word that tomorrow is not only Juneteenth, which has now become a federal holiday as a result of President Biden pushing through with it. And in 2023, although it had become a state holiday, the city of San Diego was at the George Stevens Senior Center, and the mayor signed into law provision making it a paid holiday. And so the Juneteenth flag is being raised, and we help people understand, if they don't know it by now, it started in Galveston, Texas in 1865 when General Granger showed up 2 years after slaves had been freed with order number 3 letting the people of Galveston, Texas know that the slaves were no longer slaves. By that time, the 13th Amendment had been passed. Abraham Lincoln had been assassinated. Um, People were told that you can leave, but you can't take nothing with you. So we transitioned from slaves into sharecroppers and evolved into Jim Crow, and we had all of these things. But it came out of Texas. It has grown. And so tomorrow we have a number of Juneteenth celebrations, not only in San Diego, but throughout the county. The big events coming Saturday in Memorial Park with the Cooper family because the late Mr. Sidney Cooper brought Juneteenth to San Diego when he had his little fruit stand down on Imperial Avenue, and he was considered the mayor of Imperial Avenue. And so Juneteenth was named because when they were told that slaves had been freed and that Granger had come through, they weren't sure whether it was the 13th, the 14th, the 15th, the 16th, the 17th, the 18th, or the 19th. So the slaves was smart enough to say Juneteenth. Okay, and Juneteenth just happens to be a very special day in terms of the solace. Astrologically, it's the longest day of the year, and it comes on this particular day. So tomorrow is special. There are going to be all kinds of celebrations. There is a holiday in San Diego here. There'll be events going on the rest of the week. We have many of these things online for the Voice and Viewpoint on our website in terms of where various activities are. There'll be an event at the George Stevens Senior Center. I'll be there for that. The Louisiana Purchase Restaurant is having something special, and that's very significant in terms of the whole history of the Louisiana Purchase and what it represents in addition to the restaurant bringing that kind of food to the community. So these things are important, and it's going to be going all over. You got anything you want to add, Dr. Thompson? I tried to give a quick overview.
Well, one of the things that I do share about Juneteenth is that some people have used and celebrated Juneteenth for many years. They understand the education about it. And then there are some people that are doing Juneteenth as a moneymaker and a fundraiser. More than anything else, this is definitely a cultural event and is definitely to be celebrated. But we want to make sure that you get the true meaning of what Juneteenth is about. And as we go and we celebrate the different spaces, we want to shout out to, again, the Cooper family for continuing the legacy of Juneteenth. And from the streets all the way to the park, it continues to grow. And there's going to be many things all over. I'm trying to find the guide, Dr. Warren, on the page so that I can highlight some of it that is happening here in the city of San Diego. But there are a lot of different celebrations, big, small, and large.
Yes.
And it is good to see that in the climate that we're in the United States of America, that people are still celebrating Juneteenth at a whole nother level.
And you know what? I have been in Texas doing Juneteenth, and it was so exciting. I remember I was there one year in Houston when my newspaper publishers meeting was there, and the Cowboys turned out. The Black Cowboys are there, and there was a black ranch owner who invited all of us over to the ranch for a big barbecue cookout, and so it's just really a big event, and it's taken a lot of people a long time to catch on because growing up in the East, I never heard of Juneteenth until we got here. But there were so many people that came from Texas to California that they brought it in from Oklahoma. I believe Mr. Cooper came from Oklahoma. And so these people have stayed the course with it. They've grown the celebration to the extent that now it's a national holiday. And it's something that our wonderful president can't change or get rid of. And so we're going to continue the celebration. And so we're encouraging to just go look. You can go look online. You can go to social media. There's just celebrations every place. And keep in mind what it means. Juneteenth is the African American 4th of July. It's our Independence Day. And so we celebrate it as such, okay? Our history honoring our shared spaces. And so we want to do that and encourage you. Anything else there, Dr. Thompson? Because we're running on the clock. I like to say we got a budget for the city, and we had some things that got dropped out, but we're going forward, and so we're excited. What's that? A pancake breakfast? Where?
So there's a financial literacy breakfast in celebration of Juneteenth on Thursday at MacArthur Park in La Mesa. This going through at Juneteenth at Choice Creek Lake.
Yep.
On the 14th, which is already passed.
Right. That was we
and
covered that.
We had the Juneteenth celebration this Saturday, and that is the Cooper family.
Right.
And it's going to be from 11 to 6.
The Memorial Park.
Yeah, and that's excellent. R&B block party Juneteenth, and that has already passed also.
Also, the Old Globe on Sunday had a Juneteenth celebration from 11 to 1
Yeah.
as well.
Yeah, so, and then you have the Juneteenth barbecue and summer kickoff at La Jolla Shores. Now, that's a new one.
Yeah.
They have one at La Jolla Shores.
I ain't kidding.
And that is taking place. It is a free event. And then San Diego Melanin, 7th annual Juneteenth, and they call it Kinfolk Festival.
Yeah.
Yeah, and that is has already passed also. But they had a big crowd out there. I remember covering that also. You also have the 619 day. They're having an event also on this Saturday, and it is going to be at the Naval Training Center.
Right.
And it's going to be from 12 to 6:30 p.m. And there's just a myriad of things. I'm actually on, believe it or not, the Voice and Viewpoint page and your website, and you guys did an outstanding job
Yes.
with this. It's like the kickback at Juneteenth celebration. That's tomorrow, and that is going to be at the, what is that?
Divisionary Theater, Clark
yes.
Cabaret. Yeah.
Yes, and so that's happening tomorrow. We also have, I want to make sure that we didn't miss it. Yes, the night at the Black Museum, a community celebration hosted by the Casa del Rio Moro African Latino Museum.
Yeah.
And they're going to have that. The tickets are $40, and it goes on and on. You have mentioned the Louisiana Purchase.
Yep.
That is happening on the 22nd from 12 to 4, and it just keeps going on and on. So what I will say to you all, if you will go to the San Diego Voice and Viewpoint website and just go in the search, just say Juneteenth, and all these things that I shared with you will come up. And Dr. Warren, I just want to celebrate you. The website is looking good. I got on there and tried to do my standard search, and I said, why am I trying to do the standard search? Let me go to the search, and just type in what I'm looking for.
Yeah.
And boom, bip, bam, boom, it all came into place, and I love every bit of it.
The
And
transformation is still ongoing, and it's phenomenal in terms of what we're doing. And I'm just so proud of the staff. And even today, we were able to go to press early with LaTanya being in New Jersey for our Family Foundation Juneteenth celebration tomorrow. And me not being able to be there, the paper got out without either of us putting our hands on it because the staff knew what to do and they got it done. And I want to encourage you to read my editorial this week because my editorial, and it's in the paper and it was sent to 200 black media outlets around the country. And the theme is, if the millions marching would only vote, and we want people to, it's not about 5 million people marching last Saturday, King's Day. That would be significant if 5 million people were able to show that they were registered voters, number one, and that they were conducting recalls of those Republicans who are violating their oath of office by not standing up and doing their judicial duties. Those are the things that we're pushing for. And so I'm on video. I'll be on video talking about this as we continue to send it around the country. And we're going to wake people up, and we're going to get them involved, and we're going to make a change.
Wonderful, Dr. Warren. Again, I know that you're soon to go to the
NNPA, the National Newspaper Publishers Association.
We hope to have some good results and come back with some great news after you get back of how the black press is going to be expanding and changing.
Well, it's in our 198th year. We're 2 years from our 200th anniversary. And I am running for chairman of the board of that organization. So we're going to see how things go.
And so we want to say thank you to each and every one of you all that have been tuned in. Want to thank all of the listeners around the world. Again, congratulations to our program director, Dr. Michelle, and the GOD Radio family for being up again for another Stellar Award for programming and content. It is going to be a very, very great year. We're expanding on all fronts. Continue to tune in, continue to download our apps, continue to follow. Realize this is 24 hours a day, 7 days a week. You don't have to wait to see us live. You can go to the instant replay, or you can just tap into our app, and we are 24 hours a day, 7 days a week. We're going to continue to have great guests that are coming on. You had the pleasure of meeting, I don't want to call it Dr. Todd, but you know,
she ain't a doctor.
her skill set,
we won't do that.
her skill set
Yep.
will just say that she is going to be a change agent for us. And we want to say thank you so much for coming. And stay tuned, ladies and gentlemen. More to come from San Ysidro Health.
And we're going to have you come back again.
Thank you.
All
It's
right.
my pleasure.
I got to run.
Y'all be blessed. Have a very great night. This is from the desk of the editor with Dr. John Warren.